Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and this is COVID 19 World News. In this presentation, we are going to be talking about the continent of Africa. As you can see, Africa has 52 plus 2 countries with a population of 1.27 billion people. And the most interesting statistics here is only 6.5% of their population is over 65 years, which is an important number to keep in mind when it relates to COVID-19 cases. Despite a population of 1.27 billion people, African continent, the entire continent, has only 1.5 million cases of COVID-19, with a total death of 36,399, which is less than that of Italy. So if you look at the top 10 countries in Africa, South Africa has the highest number of cases, equaling to almost 700,000, with 16,900 deaths, which is almost 50% of the deaths happening in Africa. And South Africa has a population of 59.5 million people. Next is Egypt, with a population of 102 million people, which has recorded only roughly 100,000 cases. That is one case per 1,000 population, with almost about 6,000 deaths. The next country that comes is Morocco, which is having 131,000 plus cases with 2,293 deaths. As you can see, the number of tests done in these countries is a fraction of what you have seen in the United States and Europe. Another interesting point is South Africa is the only country that has death rates per million population in triple digit. All the rest of the countries, their death rates are considerably lower. And we will look at why African continent has a much lower incidence of COVID-19 and why they have such low mortality. We will explore some of those points in a couple of minutes. And the rest of the countries have very small number of cases recorded. That may be a reflection of the number of tests performed in these places, and it may be much different if they did the number of tests to the tune of what was done in, say, for example, Germany, United Kingdom, or the United States. Let's look at a graph of South Africa. A graph tells a lot. The trend tells a lot about what's happening. It started somewhere around March 3rd week, and it had a very steady, slow upstroke, similar to the one we have seen in India. It reaches the peak somewhere in the middle of July. Then it has a rapid decline, fairly rapid decline, but it is not all the way to the baseline. Even as late as September, South Africa was recording approximately 1,800 cases, new cases per day. And here is a chart looking at the death rates in South Africa, which was in the range of like 200 to 400 per day, in contrast to many European countries and the United States, where the death rates were considerably higher. Here's another country, the next one I'm going to look at, Egypt, which also had a similar start a few days earlier, around March 10th. Then it also peaked around June. At the peak, it had about 1,500 to 1,700 cases. Then there has been a rapid decline in the number of cases, and the number of cases are approximately like 150 per day in Egypt at the end of September. Here are some of the reasons given as why African continent had the lowest mortality and the lowest number of active corona cases. Timely response. We'll explore a little bit about that. The second important point is the younger population, which I already talked about. As you know, when the coronavirus swept through Europe and United States, majority of the deaths happened in the older population. People in the ages between 65 and 80 were almost like 80 to 90 times more likely to die from COVID compared to children or adults less than 20 years old. So that might have something to do with the mortalities that we have seen in Africa. Similarly, talking about mobility and travel. And if you look at every other country in the world, they got cases starting with people coming from China, from places where the COVID-19 was epidemic. There's a great variation in the African countries about the economic status. Some countries are extremely doing well, while other countries could be extremely poor. But nonetheless, as you can see, people are still following the simple self-mitigation rules, which are the only things next to vaccine that can prevent one from getting COVID-19 infection. Example, using masks, using social distance. These are basic things which keep us from getting the virus. We don't have an actual cure for the virus at this time. Next thing, washing hands. They may not have free flow of water, but whatever source of water they are able to get, they are able to wash their hands frequently and thus prevent the spread of the coronavirus. The second point is the younger population, which I talked about. So the younger the population, the lesser the incidence of COVID-19, and even those who get this virus infection, they are less likely to get very sick. Another important thing they noticed was that more than 80% of the people who had COVID had no symptoms. This may be related to the fact that people in African continent had been exposed to so many pandemics, their bodies had developed so many different kinds of antibodies, so maybe they were able to fight the virus in a much better manner than people in the Western world or people in the European countries. We talked about mobility. Because of the distance, because of the cost involved in air travel, the number of people traveling in and out of African continent is very limited, and that indirectly probably helped to minimize the spread of COVID infection all across the continent. One interesting observation that I made is that one of the United States mobile units firm has been able to deliver the medicines, and they have been doing this for several years in various pandemics, using drones to deliver medical supplies, PPEs, and drugs to remote areas where you cannot reach very easily. So, ladies and gentlemen, this is the story of COVID-19 in the continent of Africa, with 1.27 billion people, where only 6.5% of the people are over the age of 65 years. They have recorded only 1.5 million cases of active COVID, with less than 37,000 deaths. This is quite different from what we have seen in the Western world, in Europe, and other countries. Thank you so much for watching this presentation, and stay tuned for my upcoming book on COVID-19 pandemic 2019-2020, an international guide for future pandemics. And please do subscribe to our YouTube channel. And you have been watching Triple N Media COVID-19 World News. I am Dr. NIK NIKAM from Houston, Texas.